Funding provided by the League of Women Voters Project Fund.
Thank you. Moving on to Amendment 69, Statewide Healthcare System. Adds Article 30 to the Colorado Constitution to provide healthcare to the residents of the state. Major provisions include provide access to affordable healthcare to all residents of Colorado, establish a governing board, first appointed and later elected to administer Colorado healthcare, creates a taxing system to finance Colorado care, allows waivers to be obtained from the insurance exchange program to create a unique Colorado healthcare system.
My name is Dyar. I've been a Grand Junction resident on and off for about 10 years. I want to thank the League of Women Voters, Robin Parker, Diar, all the folks that worked really hard to make this happen. Thanks to the Sociology Club, and thank you to some of these cool CMU students for giving me a little bit of hope about the next generation. It's good to see you out here. It would be nice to have more of your peers, but I'm sure they'll ask you how to vote, so make it count. I have had the great fortune to get to see a whole lot of the world. And I've given my life to working alongside and on behalf of vulnerable populations. Here in Colorado, up and down the Western Slope, in Central and South America, and recently in New Zealand. And in the course of some very diverse work on behalf of people that are really struggling in our world, I have got to see how the healthcare system makes a really big difference in the kind of lives people get to lead here, as our neighbors here in Colorado and other countries. And I've lived in countries where you can show up to the ER with a sick child in your arms, and if you don't have enough cash in your pocket, you're not getting in the door. And I've lived in countries that manage to cover everybody, every one of their citizens, from -9 months to their last day on earth, and to do it at far better cost than we do. And I've gotten to see that play out, and that really sparked my interest in Amendment 69, Colorado Care, which is a proposal to fix our broken healthcare system here in Colorado for the benefit of everybody, the 5 million people in the state, and especially for the benefit of rural areas like Mesa County. I personally hold degrees in business administration, political science, and masters in community development. I've gotten to see how healthcare plays out in so many different scenarios, whether how it affects housing policy, how it affects the fates of working families, how it affects people's ability to bootstrap their ways into the middle class and success, how it impacts people's ability to transition into a dignified retirement. And so I'm happy really to address a lot of those topics tonight. Thank you for Diane for being here on behalf of the opposition, and we'll be back in a moment.
Good evening. I am Diane Schwenke, and I have my Bronco colors on, and last I heard it wasn't helping. I too would like to add my thanks to the League, to CMU, to Joel for being here, and I too am looking forward to the conversation. I think most of you don't need an introduction to who I am. I'm the CEO of the Grand Junction Area Chamber, an organization of about 950, mostly small businesses, 80% of which have 10 employees or less, but overall representing 37,000 employees in this area. And I spend my days out working with the job creators of this community, and I'm proud of that. But I'm also here tonight representing Coloradans for Coloradans, the No on Amendment 69 campaign, and I'm equally proud to be affiliated with them, particularly the co-chairs, the former governor of the state, Bill Ritter, and our current state treasurer, Walker Stapleton, and over 1,350 other organizations, businesses, and individuals across the state who say Amendment 69 is not the answer to our healthcare problems. And I'd like to just kind of share some of who they are, because I think it's important to know that from Durango to Sterling and from Lamar to Craig, we have a lot of people and a lot of groups, including the Sheet Metal Union Workers Local 9, Colorado Rural Health Council, businesses like Auto Paychecks, Holiday Cleaners, Butte Water, Moody Insurance, and then statewide organizations like the Colorado Realtors. It is a very diverse group representing a lot of people in the state who have grave concerns about what this amendment will do to our economy. Thank you. I too look forward to the discussion.
Joel Dyar is representing the proponents of Amendment 69. Mr. Dyar, will you please state your 6-minute position on this issue?
Let's start with the bad news. There's something uniquely wrong in how America takes care of its people. In 2014, the Commonwealth Fund and the World Bank did a study of the U.S. and our 10 biggest international competitors. And congrats, America's #1. We are #1 in the world for per capita healthcare spending. We spend $9,200 on average on every person in our country for healthcare. Our closest competitor, with whom our manufacturers, our service providers, our college grads have to compete, is Germany. And they cover everybody spending $5,000 a year. The list falls off pretty quickly after that. There's something uniquely wrong in Colorado. We have 780,000 people out of a population of 5 million who are underinsured, which means they're paying too much for health care that they really can't afford to use. They probably think it's going to be there the day they need it, and I hope too many of them don't have to find out the hard truth before we can fix these problems. Lastly, we've got 350,000 people in the state that, despite the expansion of Medicaid under the Affordable Care Act, remain uninsured entirely. They've got two options to get health care. The first is out of pocket, and the second is the emergency room. And let me tell you how much that emergency room stinks. Because I've got a friend who 6 months ago learned that she's got stage 4 breast cancer. And she learned that because she's got a $5,000 deductible and 2 kids, and she chose not to go get that one little funny thing checked out because she didn't want to take money away from her kids. And so she ended up in ER. So not only is that a terrible moral crime against her and her children, that we enabled that to happen, especially when she was paying for insurance, but it's a crime against the rest of us because we paid that outrageous cost of her treatment that she's now going to receive on the public dime when we could have fixed it for a much more reasonable cost much earlier. She actually had access to insurance and health care. Lastly, there's some bad news for Mesa County. With the exiting of Rocky Mountain Health Plans from the health exchange, we're down to 1 insurer for a whole lot of our population. That's Anthem, Blue Cross, and Blue Shield. And guess what? They're raising premiums 26.8% next year, and they have no competitor to offer for an alternative in years going forward. So that's all the bad news. Let me tell you, actually, do me a favor, please. Would you raise your hand if you have faith in the ability of Congress to fix our healthcare system, to provide us with a path going forward? Is there one person in this room so brave? Then, thank you, Margaret. Then, everybody else, tell me what we're left to do. How else are we really going to solve these 2 crimes? The first, moral crime against our people, that we fail to offer them a way to get covered. And the crime against all our wallets, that we're paying way too much versus every other country on earth. When we otherwise have a pretty good healthcare system, but we just can't figure out how to finance it. How are we going to fix those 2 things? Amendment 69 is one attempt to do that in one state. And just like everything from women's suffrage to civil unions, to not throwing kids in prison for pot, Colorado has a chance to lead the nation on policy innovation and on finding solutions to some of the biggest challenges we face. So here's the good news. This is what Amendment 69 proposes. And do me the favor and imagine the following. What if we covered everybody? Everybody you saw today, everybody you could go find on the street, everybody in Walmart right now, every single one of our neighbors, all the time, from -9 months to their last day on earth with good quality insurance. What if we could also do that and put $2,100 a year back in the pocket of the median family in Colorado? If we could both do the right thing and save money. What if we could get rid of all premiums, all deductibles, and co-pays for primary and preventative care? What if we could offer small business a chance to actually compete with big out-of-state business by being able to provide health care for their employees? Right now, if I'm a small business owner, my average cost in America is 13.5% payroll to provide insurance for my employees. If I'm a big business, I can go in and strike a bigger deal because I've got more folks on payroll. This is a major barrier to small business being able to attract their talent. What if we could level that playing field for Colorado businesses? What if, at the same time, we could reduce the cost that seniors pay, those on Medicare, for their supplement by 85% of seniors? And lastly, what if we could replace all the convoluted bureaucracy, all the insurance companies, all the billing codes, all the people you have to call to fight for your piece of the pie if you're a hospital, if you're a doctor or a nurse at a clinic, when you really just want to go to work and take care of people, that you went into medical school to make lives better, not to spend half your day fighting some for-profit insurance company bureaucracy. What if we could offer all those things And what if I told you I could stand up here for another 10 minutes and keep going? But here's the short story. We can offer all those things with Amendment 69. We've also got a guarantee clause, where if we pass this, we have to go prove to the federal government that we're in the black, that we're sustainable for 10 years, or the waiver from the Affordable Care Act is not granted. I think this sounds like a pretty good deal. The price tag for all those things is as follows. We pay for it just like we pay for Medicare and Social Security. In this case, it's 3% on me as the employee, 6% on my employer, 10% on non-W-2 income, and that's it. That replaces every premium, every deductible, every annual enrollment, every awful artifact of a complicated and broken system, and it makes it so that we have a healthcare system we can actually understand. And I'll tell you the last big thing, one of the coolest parts about this, is you get to elect the people that are going to run it. It's not going to be Washington and Wall Street telling you what you do and do not get for your money. It's going to be your neighbors fighting to get you the health care you need and cost savings we can all share. Thank you for your time.
Thank you, Mr. Dyar. Diane Schwenke is representing the opponents of Amendment 69. Ms. Schwenke, will you please state your 6-minute position on this issue?
So as Joel was talking, I was kind of thinking of the song Imagine by the Beatles as we went through this. And I think we can all agree that we have some major issues with healthcare in this country, and that it needs to be improved. However, that being said, Amendment 69, make no mistake, is a very specific alternative in the state constitution that you will be voting on. So let's take a look at that amendment, because that's what you need to be making your decision on, not whether or not you think the system is broken, not whether or not you think that there is a way for Congress to fix it. It's Amendment 69. So let's talk about Amendment 69. So why we are opposed to it has to do with the fact that it is risky. We don't know really if it's going to work here in the state of Colorado. It hasn't been tried anywhere else, not on a state-by-state basis in this country. And we're a little uncertain. I'm not quite as confident as Joel in terms of what it's going to be able to deliver. And I will contend to you that it is unaffordable for those small businesses. So here's what we do. It's going to replace every healthcare system that you have now. Everyone comes under Colorado Care. If you are a veteran and you have TRICARE, if you are a senior and you have Medicare, you still have those, but you still also come under Colorado Care as your secondary insurer. And here's what we also know, that payroll tax and all of those taxes on your non-payroll income will raise about $25 billion. To give you perspective, the state's entire budget this year is about $27 billion. And the other thing that I think is really important to note is even under Obamacare, there was a recognition that for small businesses, particularly those with less than 50 employees, that the burden of providing health care was something that they may not be able to afford to do. So they won't be just paying 6% more in payroll taxes. They will also be paying 10% on any profit that they have left over. And that's money that in most small businesses cases goes back into rebuilding businesses and putting more money into capital investment and creating jobs. That's money that will not be available because it's going to be going into the system. And I would also contend that if you have a budget that raises $25 billion in taxes and accumulates another $11 million in federal payments for Medicaid, which is what we get now, then you're looking at trying to administer a $38 billion fund and cover every single resident of the state of Colorado. You can't tell me that you're not going to be creating a huge new bureaucracy to manage that system. It has to be in place. So, we also know, as Joel pointed out, it's going to be an elected group of 21 individuals who, by the way, one of the cool little things I think in this, and one of the twists that I don't understand, is that this board will be the only board in the entire state of Colorado that will not be subject to recall by all of you if you don't like what they're doing or you don't think they have the competence to manage this bureaucracy. And the other thing is that it's a constitutional amendment. And I was wondering how they were going to summarize in one slide what is in this amendment, because I've got a copy, and I urge you to read all 12 pages of this document, because this is what you're going to be putting into the Constitution, and this is what you will live with. So I would also contend that we think there's going to be some major unintended consequences with this. I've already had physician practices here in Grand Junction tell me my doctors have licenses in multiple states. We won't play. And here in rural Colorado, we may have coverage, but oftentimes we don't have access. And the best and the brightest from throughout the nation in healthcare will take a second look at us. What will also take a second look at us is the businesses that we are trying to attract, particularly here in this community where we're trying to target privately owned companies with 50 employees or less. These are the ones that are going to be getting 10% on top of incredible new payroll taxes to pay for the privilege of being in this community. That young software developer is not who will move here for lifestyle, we hope, can also move to New Mexico, can also go to Wyoming. So for those reasons in particular, and the concerns that I have in terms of what this is going to do to economic development and our ability to create the jobs, are part of the reason that I'm urging you to vote no. It's very hard to collect payroll taxes if you don't have the employers and you don't have the employees. And it's hard to provide it if you don't have the doctors. Please vote no.
Question on Amendment 69. Isn't Colorado Care very likely to attract physicians to Colorado since it will pay physicians at a much higher level than they're paid now?
I'm happy to go first on that one. First of all, there's nothing in the actual amendment that constitutes what providers are paid. So that's why I urge you, read what's in the actual amendment, because that's what you're voting on. So as many as Children's Hospital in Denver and others have pointed out, because of the uncertainty and because we don't know what they're going to be paid, I would suggest to you that it's very possible that we will not only not be able to attract physicians, but that we may in fact lose them. And so there's nothing anywhere in here that says that you're going to be paying physicians more.
Folks, there are two things that Mary addressing first. The first is the notion that we're imposing a 10% tax on all businesses is simply accepted. It's a 10% on non-W2 income, which would be just as small business owners pay for both their portions of Social Security and Medicare. We have a similar system, but it's a misrepresentation of the United States. We're imposing a 10% tax on all business income. I'll tell you, the easiest way to answer this question is that across the state, we have hundreds of doctors and nurses out knocking doors. And I have yet to see the opposition rallying folks to their side. I've seen plenty of specialists, plenty of people that can sit around an office and make $500,000 a year doing plastic surgery or whatever it is. But when it comes to people that are really on the front lines of medicine, we have tremendous supporters across the state that know that the system we have now needs to change, and I think this is a fair way to go about that. Thank you.
Amendment 69. Is it true people will have to pay taxes for Colorado Care whether or not they have Medicare? They will pay twice on taxes for, I believe it says, medical.
What we're proposing is essentially Medicare for everybody. When Medicare was implemented in 1966, it was opposed by just about everybody you could find. Funny enough, it wasn't opposed by the insurance companies because they found out it was actually expensive to cover seniors with health care. They were about the only folks really rooting for it. We've seen that thing turn on its head, where we're facing 99% funding of our opposition from big outside insurance companies. And really, it's not the threat of a loss of 5 million people in Colorado as a market to them that scares them. It's a threat that we can really turn this thing around nationally, and that we prove that we have a model other than the predatory draw that we now have that they can feed from. And we prove that we can do something better here in the U.S. And part of that basic promise that's embedded here in Amendment 69 is as follows, and that is we replace all current premiums, all current deductibles, and any copays with a flat payroll deduction of 3% on the employee, 6% on the employer. If you're a retired individual, because you paid into Medicare, we have two thresholds below which you pay nothing.
Thank you.
Yes.
Thank you. Yeah, and then it goes fast. Ms. Schwenke.
Short answer to that question is yes. If you make more than $24,000 as a senior, you will be paying a 10% tax on your 401k or any of your other income, investment income that you may have, in addition to anything else that, so you will be paying it. Short answer. Two other things I'd like to address very quickly that Joel mentioned. One is that 98% of the funding for this campaign is coming from huge and out-of-state insurance companies. In point of fact, 55% of the funding for this effort is coming from people who are writing checks of $100 or less in this state. And $100,000 came from the Colorado realtors because they see what it will do to their income as realtors. The other thing I want to also address and clear up, and maybe I misheard it, but the reality is that if you are a small business owner, if you're a sole proprietor, an LLC, or an S-Corp, you will be paying 10% of your income as declared on your W-2 in addition to those payroll taxes.
Thank you, Mr. Is healthcare a right or a privilege? Isn't it an ethical concern when people have to choose between seeking treatment or avoiding lifelong death?
Bit of a loaded question there. However, I think the reality is right now is that our healthcare system is not serving everyone. And so it does need to be fixed. But take a look at Amendment 69, because that's your choice right now, is Amendment 69. And in Amendment 69, I think we see some major issues. And I'd like to give a quote right now from Ian Silveride of Progress Now, who said that instead of abandoning the progress that we're already making in Colorado in recent years to cut our uncovered folks in half, instead of abandoning the progress we've made in Colorado in recent years, we need to focus on protecting the gains that we've already made and build on that process instead of starting from scratch. Progress Now is asking you also to vote no on Amendment 69.
Thank you. Mr. Dyar, for your response.
I've got some more bad news. We can't do everything for medicine. You know, one of the challenges working right here in the U.S. and all our international competitors that are presently kind of kicking our butts in terms of outcomes and spending or confronting is that we can do some remarkable things in medicine today. They're also terribly costly. And so no one's going to get up and tell you Amendment 69 will solve every problem we have. But the reality is there is so much waste, both in terms of the cost of human lives and the keeping of people from their true potential. And also in terms of the way for-profit health insurance operates. The average for-profit insurance company with a plan on exchange has a 20% administrative overhead rate. Medicare has a 3.5% rate. We see that kind of a rate repeated across East Asia and Europe, north of us in Canada. And so we have so much waste in our system now, I don't think it's fair to say that we can't do a lot better by implementing a plan that's far more simple, far more honest, and is something that can innovate, can be accountable to us as voters, and can really carry us forward in tackling this collectively.
Thank you, Mr. Dyar. Why is Amendment 69 so anti-senior citizen? It will tax investment income, 401k, IRA, earned years ago, sometimes earned in other states. If I like my healthcare plan as a doctor, why will you take that away? Why can't you just leave me alone?
Actuarial analysis says that Amendment 69 saves 85% of seniors' money. Folks on Medicare will save only supplemental. They also, congratulations to those folks who lived a full life and paid in and got to enjoy the benefits of Medicare. Medicare is the most successful social program, the most popular in the U.S., and it's tremendously popular across party lines. Wouldn't it be great if everybody else had access to a system that is that simple, that honest, and that efficient?
So, in response to that question, I do believe that the seniors who have saved are going to be penalized underneath the system. There's no way, if you're already getting Medicare, and then you're paying 10% of your investment income over $24,000, you are being double taxed. I also think that it's really important to consider the other economic impacts of this effort, which is a go-it-alone, complicated measure in the state constitution. And I would quote from the governor of the state of Vermont, the one other state that looked at this, who says, quote, "These are simply not tax rates that I can responsibly support or urge the legislature to pass at this time. In my judgment, the potential economic disruption and risk would be too great to small businesses, working families, and the state's economy. So it's not just the senior citizens that are at risk under this."